You may wonder if you're going to know when you're really in labor, or you may wonder, will it just be false labor? Hi, I'm Susan White. I'm a certified nurse midwife, an author, and a childbirth educator. And today I wanted to discuss the difference and how you're going to know if you're really going into labor or if it's false labor. Which I really don't like that term false labor. It sounds like you're faking it. Like you can really have contractions that hurt, but you're not really going on into active labor yet. So, false labor, another term for that is pre labor, which is more descriptive. So, that's your body really getting ready for labor. Things are kind of, your hormones are lining up and your body's getting ready. And really, the more pre labor you have, when you go into real labor, it's going to be a little easier for you because your body's already prepped for labor. Okay, let's talk about some things that can happen before labor even starts that your body's getting ready. One thing is the baby can drop down, and the term for that is engagement, which means the head is dropped down into the pelvis. If this is your first time baby, this can happen about 2 weeks before labor starts. If you've had babies before, the head's going to descend during labor. You'll notice after the baby drops down that you'll be able to breathe easier, but you have to urinate even more often. You're also going to notice more Braxton Hicks contractions. Those are the contractions your body has as it's kind of practicing it for labor. You think about the uterus as a muscle. And so it's sort of like exercising, having those contractions, getting ready for labor to start. Those contractions don't hurt. You just might feel like a tightening, especially if you put your hand on your belly. Okay, so you'll notice more of those. You also may notice more mucousy discharge. Now, a lot of people talk about how to know if you're losing your mucus plug. You really don't have to worry about that. Your body continues to make mucus the whole time, even during labor. And so there's no way to know if you lose the mucus plug. And actually, it doesn't really tell you at all when labor is going to start anyway. So don't worry about the mucus plug. You might notice some natural diarrhea. That is just the body's way of kind of making more room for the baby to descend. And it's because of the prostaglandins that are released that causes that diarrhea. You may have a burst of energy where you want to clean the whole house and paint the nursery and all of that. You just want to be a little cautious not to go too crazy with your activity, because if you go into labor and you're really exhausted, that can make your contractions hurt more. Okay? Then also, if you start having contractions, how do you know if it's that pre-false labor stuff or if it's true labor? One way to know is that if you feel the contractions more in the front, it's usually the pre or the false labor. The true labor contractions are felt lower in the groin or maybe in the lower back. They kind of feel like menstrual cramps as they get started. The other thing is the contractions with the false or the pre-labor, they do not get closer together or stronger or last longer. But in real labor, they do. They will start getting closer together, they'll start lasting longer and getting stronger as time goes on. Another way to tell is if you change your activity, that may change your contractions if it's the false or pre-labor. So what I mean is if you maybe decide to lay down for a while, the contractions can actually space out. But if it's true labor, you'll keep having contractions no matter what your activity does. Sometimes they are a little stronger when you're walking. Now, the main difference between the pre and false labor compared to true labor is that your contractions will cause your cervix to change if it's the true labor. And that's really the best way to know and the only way to know for sure. So obviously you would need to call your midwife or go to the hospital to get checked, to get a vag exam and see if your cervix is changing or not with your contractions. So what does early labor feel like? Well, we said the contractions are mild, sort of like menstrual cramps. During that early labor time, it's really normal to have contractions for a while and then they stop, and then you have them again later for a few hours and then they stop. Having those intermittent periods of contractions is totally normal, and it's really a good thing because all of that pre-labor and early labor helps your body be ready for labor more. So all the hormones are being released, everything's getting ready, so that when you go on into real active labor, your body should be able to actually function a little better. Things might be a little easier and quicker for you. So it's really best to let nature take its course in that situation and just try to be patient with your body. So you may also notice in earlier pre-labor you're having a dull backache with that. You might start seeing some bloody show, and that should be like mucus with little tinges of blood. Bleeding is never normal. So if you start having bleeding, you want to call your midwife or physician right away. Also, in early labor, the contractions are not that strong yet. You're able to talk through contractions. You're able to do your normal activity. So most women do not need to start using the relaxation and breathing techniques or take any kind of pain medicine during that really early labor. Now, one exception to that is if you're having your labor induced with Pitocin. We know in the research and from talking to women that have had contractions with Pitocin and contractions without Pitocin, that Pitocin contractions actually do cause more pain. So if you're getting your labor induced and you're having Pitocin, even in early labor, you may need to start using your comfort measures or consider whatever pain management plan you're looking at. Now, most women are at home during that early labor, and what you want to do is just continue whatever your normal activity is. So eating, drinking, sleeping, resting, walking, whatever you'd like to do. If you're going into labor and you do go to sleep, believe me, the contractions will wake you up if they start getting stronger. So whatever your normal activity is good. If you want to get in the tub or take a shower, that's very relaxing. Now, when do you go to the hospital or when do you call your midwife? So 2 things that you really want to be aware of and remember is that if your water breaks before you start having contractions or anytime during early labor, go on and call your midwife or go to the hospital, because once your water breaks, then your labor should start picking up within the next 24 hours, but there is a risk of infection, and so you want to talk to your midwife or physician about what the plan is at that point if your water breaks and you're not having many contractions yet. The other reason to call your midwife or go to the hospital is when your contractions get close enough. So what we want to do is have you time contractions, and you time those from the beginning of one contraction to the beginning of the next. It doesn't really matter how long they last. It doesn't matter how much time is in between the contractions, but you want to time them from the beginning of one to the beginning of the next. So if a contraction starts at 9 o'clock and another one at 5 minutes after 9, obviously that's 5 minutes apart. Now, most physicians and midwives want you to let them know or go to the hospital when your contractions are 5 minutes apart for about 2 hours. Now, if you've had a history of really quick labors before, or if you live a long distance from the hospital or from your midwife, then you may want to notify them sooner than that. But that's usually the ballpark. It's contractions every 5 minutes for 2 hours. And then, like we said, also if you have ruptured membranes. And this is all considering if you're full term. So that means that you are close to your due date. And full term is considered at 37 weeks, although now we know babies are much healthier if they're born closer to 39 to 40 weeks. So I hope this has been helpful for you. If it was helpful, please click like and subscribe to my channel. And also, please let me know in the comments what other content would be helpful for you, and I'll be glad to check into making a video for that. Also, please check in the description below. I have a link to my website, and we are offering Christian Childbirth Education Classes, and those are virtual live classes, so please check that out, and thank you.